What's happening, y'all? So y'all know this is the second portion to Oncology 1 that we did the other day. Okay, so how's everybody tonight? I know we usually do 6, but some of you are coming in late from work, and I'm trying to make sure some of you all go ahead and get in here. You still can archive for the next day. Let's just talk about Sapphire Portal for a few minutes. So those of you who do purchase just one course, the one course does not give you Sapphire access. You have to join the full program. So when you do that, go to sapphirephysiciancoding.com, hit the link that says explore more courses, and click either one of those programs, the advanced, the basic, or the transitional. Now, September 15th, those courses are going to go back since, the summer is over. And sometimes you guys know I put a little tuition discount on that. And it will go back on the 15th. So those of you who want to get in on that $59.99 now, go ahead and get it. This is a self-taught class. You're given the tools to do the work that you need to do. You're put in the right place that you need to be put in. And you still have your classes. So the classes are adhered on YouTube. Once I finish with this cycle, the next cycle, I'm going to put the chats back to private, and Sapphire will only be able to achieve those chats. Now, anybody can look at these chats. If you sign on to my YouTube and you want to look at the chats and you want to see what Miss Lambert is all about and what she's doing, that's what you sign on to. You guys know I do not hold your hand. You go to the Sapphire portal. I will give you your email. You and I will do one-on-one. I'll walk you through. Check out that chat. I'll walk through a little bit, and I have 100 chats where I walk through Sapphire. Sapphire Physician Coding Academy, the Sapphire portal tool is where you're going to see schedules. You see different schedules. That's why I said when you get the advanced one, and remember that advanced one is changing. So September 15th is when that's going back to its regular tuition. You guys know I always do a tuition break for the summer. So anyway, the Sapphire portal, you can go in there and you can change your schedule if you want to, but you're going to have to let me know. The email that you are assigned, that's your Sapphire coding email, Sapphire Physician Coding email. You're going to send me an email and say, Miss Lambert, I might need to do it in the advanced class. I don't want to just do the medical billing. Okay. If you got that course just for medical billing, don't worry about it. And that course right now is only $10. You can go ahead and add your $50 on and go ahead and get the other course. Don't wait till the course goes back to $1,389. Unless you have a promo code from me, that's the price that it is going to be. I'm working out something with my son to see how we can alleviate, since, we did pretty good this summer. You guys came in really good, and a lot of you have bought a lot of courses. And a lot of you who are just purchasing courses, you guys are already working. So that's cool. That's understandable. That's what the individual courses are for. People who are already working and good. But when you just get the course, you don't get access to the Sapphire portal. But that's cool. If that's what you want to do, I want you to still follow these courses. Some of you don't need to follow the course chats because you're already working and you just need that brush up. Okay, but when you do register for the class, when you go to that bookstore and you go to that checkout, you will automatically have a download. Okay, you will automatically download your orientation. The orientation will entitle PDFs, and I'm on there. I have a video on there. I have a look at that video in a minute. If it's chappy, make sure you get the orientation here or email me, Miss Lambert, the video's chappy. Okay, I just put you through the right video. All right. So again, you'll have your orientation, and orientation is 1 week. You guys remember that. Orientation is 1 week. We went over this the other day. So when you don't listen to how y'all know I don't have no sense. This first week, okay, This is your orientation week. If you purchase a program today, this is your full week of program. Don't cram. Read the first 3. You got PDFs that you have to do. Your digital form is PDF. If you have your email, let me know if you don't have your email to get into that portal. This is in the portal. This is in the portal. There are 3 separate runs: the basic, transitional, and the advanced one. Okay, this is a 20-week one. This is a transitional one. So this full week is your orientation. You should be reading the material that I gave you, that you downloaded. You should be looking at that full video that I gave you, downloaded. Okay, make sure you look at the video. Okay, or you can always find that orientation video in YouTube. You can, that same video is in YouTube. I'm going to go over it tonight. Make sure you guys got all the good stuff in there. I'll probably put a couple of more links in there, but that link should hit you to that orientation. Okay, once you finish with that orientation, I will give you a code. If you choose to download all of the courses, that's what the code is for. Okay, if you've already got your registration for the program, you don't really have to download, because all of the programs are already in the Sapphire portal. Okay, they're already in the Sapphire portal. Okay, so you guys know when I say just pace yourself. Give yourself 2 hours, give yourself 3 hours. There's no reason for me to hold your hand when you get a course, and you just need to follow. In the YouTube, I find it better for me to do the courses do the chat in the YouTube, because you guys can archive whenever you want to. So remember, there's 3 playlists: the medical billing and coding virtual, that's medical billing; the medical terminology playlist, that's the class we're getting ready to do right now; the coding playlist, that's strictly coding. That's strictly coding. We're starting coding from scratch. So some of you who are getting in on the classroom right now, I'm going to drop the books up here. You must have books to join the class. Okay? I don't know what that was. You don't have to get all the books at the same time. You can get one at a time. Okay? That's your coding books, your CPT and your ICD-10. Okay? That's your HICS books. You will need that for the coding lessons. You need that for the coding lessons. They don't have to be 2025. You guys know I like ebooks. I use the 2025 books. You can get the year before. But if you plan on taking your certification this year, I want you to get your 2025, okay? That's your medical insurance billing book. So I do have a couple of new guys that you guys just started. I do want you guys to get this book. Do not forget that you still can look at this book in the Kindle. You still can look at this book in the Kindle. I did put the links up there. So in that description bar, you should see those links in there. But you guys know, I always kind of still drop them on the side so you guys can get them. So the link for the ICD-10, I'm going to drop that on the side. And this is because some of you may not have your books. Okay, so I'm going to drop AAPC there, because I want y'all to know what tests you are going to be taking. You're taking your AAPC test for certified CPC, okay? What I'm doing right now is just kind of dropping a few links over there. This is your ICD-10 link from the Kindle. When you open this and you have Kindle, you should be able to get right to that book, okay? So again, your ICD-10, your CPT, all are there. Oh, my hand is itching. All are there. Let me get the last one. Okay, so you guys are okay for now, because we have not gotten up to the coding yet, and you guys still have 3 classes left. Okay, I don't know what that is. All right, so this is a CPT book here. Let's go ahead and drop that in. All right, then I'm gonna drop the HICS book in there. Okay. Now, for some of you who are not familiar with the coding, some of you who are not familiar with the HICS, some of you who are not familiar with the ICD-10, this is your go-to. Okay. So your medical insurance billing book you can get from thrift.com. You can get that a little cheaper. This book has not changed. Okay. That's your go-to. Okay, that's your step-by-step guide. When we go to the coding, I'm hoping that you guys, look at my tree. I'm hoping that you guys have your book. Okay, so that's your step-by-step book right there. Okay, and you need both because you're going to do the exercises. Okay, the ISBN numbers are here, and I also put that down below. Okay, this is what we're working on right now, your language of medicine. You can always get the year before that, it is the same. When you register for the Sapphire class, this book is already in your class. Okay, it's already in here, so you don't need to purchase it. Okay, so I'm also going to put the website up here. All right, let's drop that website up there. I don't know why I do that. Oh, okay. The sapphirephysiciancoding.com. You can go on there and you're going to click that thing that says book link. So right now, the advanced program, it's got that summer tuition break. So that's why when you guys go on there, you're going to see that advanced program for $59.99. Now that program is going to go back to $13.89. We've got to see how we're going to do it. I'm not really finished on doing it. Not for YTU, not for Sapphire. Usually, the most $13.89 is what I charge the schools. They got to buy the whole thing. Okay, they have to get their whole program. Okay, so for the YTU and the Sapphire, we'll probably put it back to what it normally is for you guys, which is the $199. But I got to give you a grant code for that. I haven't gotten any grants the end of this year. I usually get them around November, and that's when I can give you the grant. But just let me know, and I will give you guys that code. I'll let you know when we put it back. When we're putting it back to 15, but you're gonna have to need a code with it. But for now, $59.99. Get the advanced class. Okay. So let's move on. So in your Sapphire coding course, I'm just kind of backtracking on a couple of things here, just to kind of get you guys together. So some of you who are joining my class, you guys are registering on the site where the books are and the courses are and the manuals are, which is fine. This is the advanced course that you are registering for. That's your transitional course. See, there are different courses with different things in them. The advanced course has all of the courses in there, all 21 courses. All 21 parts of the body, medical billing, medical coding, medical terminology is in this. Okay. Transitional coding is pretty much the same. Medical billing, medical terminology. Okay. And it is an introduction to the coding. The basic is just medical billing, medical terminology. All right. When you go in there, you will see that. So when you go on my site, you click that link within that website, and it will take you to the bookstore, and you guys can navigate those courses. Okay. So today we are going over chapter 19. We've actually already did some of it. It just was kind of long, and I didn't want to kind of like rush through it because all of these chapters get interesting. They all get interesting. We were talking about oncology. We were talking about breast cancer, and it's I won't say it's always somebody that we know, but there's somebody that we always either know or familiar with that has known someone who has had the cancer. And you guys remember we were talking about why can't they come up with something? Why can't they come up with something to get rid of the cancer? They've got the HIV under control. They got tuberculosis under control. And then on my Twitter, Grok sent me the Russia thing. I was like, oh my God, we were just talking about that. Gosh, can they let us see something, some type of experiment? I don't care if it's an experiment, if it's a trial, if it's a something. Is there not anything to help us with the cancer? Boom, Russia. Now, I ain't hating on Russia for that now. I'm telling you right now, I hope whatever it is that they're doing, they make it happen, okay? Here, 19, I'm just going to go to the page that I left off with. So, yes, we definitely, I don't care. I kind of support that. If they got people to do trials with him, let's see what happens. Okay, so again, we were doing introduction, carcinoma, vocabulary, cancer treatments, and laboratory tests. And we're just backtracking, introduction, carcinogenesis, classification of tumors, We're talking about metastasis. So you guys had homework on YTU, Sapphire, both of you had homework with the metastasis and metastasize. Okay, has a cancer metastasized? Is a cancer in a metastasis stage? Y'all supposed to have homework doing that, all right? For medical terminology, this course right here, you guys want tests, you have to get that book, okay? So when you go to Amazon.com, just type in my name and all of my books will show up. Get the medical terminology one. And this is if you're not joining the program. If you're not joining the Sapphire program, you can go ahead and get the book. And those of y'all who are already in the program, most of y'all have got the book already. Some of you don't, some of you new ones don't have the book. But the tests that are in the books are in the Sapphire portal. Okay, so I think we was on page 760. Let me see. So we did basal layer, melanocytes, squamous cell layer. So you guys had to put these. I'm just backtracking a little bit. Reproductive organs, lung, and we're talking about types of areas where cancer may be or cancer may derive, carcinomas and the epithelial tissue from which they derive. So we just kind of put this down for you guys to make sure that you are studying the right things. There are different types, but I still want you to study the main ones: gastrointestinal tract, colon, esophagus, liver, stomach, glandular tissues, adrenal glands, carcinoma of the adrenal glands, breast, carcinoma of the breast, pancreas, carcinoma of the pancreas, prostate, carcinoma of the prostate, salivary glands, adenocystic carcinoma, thyroid, carcinoma of the thyroid. So when we talk about cancer, we're not just talking about in one area. I know some of you are probably going into specialty areas, but I still think that you doing the full CPC would be excellent for you guys. So just continue to thrive on that. Some of you who have just registered for the class, after you finish your orientation, you will start your medical billing. So the medical billing is first. Medical billing, medical terminology is in the coding. Now, if you're going to follow the class, then I suggest you go ahead and get in on the coding, or you're going to archive the medical billing. And this is if you want to kind of do everything. Medical billing is not necessary in coding. You do not have to do medical billing. Medical terminology is. When you see those boot camps and those crash courses that they have, most of those girls already have medical billing. They just drop it in the boot camp. Here we start from scratch from medical terminology and medical billing. If you guys see, we're already up to chapter 19. We have 3 chapters left in this course, okay? And then we're going to start the coding. So those of you who have just registered, who have just started in the Sapphire and you have access to the portal, go ahead in there and look at what you need to look at. I have not done the files yet for the new students. I'm going in there tomorrow and I'm going to put all of your files in there. When y'all take your test, the test comes to me, I need to grade it. I will be putting it back in your folder. When we are doing one-on-one, I will be sending y'all an email. Okay, I'm going to send y'all an email for teams. That's for our one-on-one. If y'all want to do discussion board, remember when you go into Sapphire portal, you can, if you text me something through Sapphire portal, I will get it as if it was an email or something. So you know, if you're in there and you're like, I need this link right now. Just you don't have to stop and call me and all that kind of stuff. Just get in the Sapphire portal and that discussion board part right there. That's where you could just shoot at me. Okay, not shoot at me. Okay, so that's a good thing. I don't know why. I was like mad tired today. I had some like fried chicken, and y'all know I don't eat fried chicken. I had it, well, you know, of course I did when I was little, but I cut that out. Unless my sister used to cook, you know, chicken, but I can't do the grease. I can't, your whole body just goes. And I had my coffee on over there. I didn't get a chance to make it, but I started feeling a little better. No, I don't take my Ozempic all the time. I do still take the Ozempic, but it could be the Ozempic. You know, if you eat something and Ozempic does not agree with you, you go into the bathroom. But I don't take my Ozempic like how I used to. I take it, and then I take it. I know it's not going to work like that, but it kind of may change a little bit. I mean, I probably gained back about 30 pounds. Um, I didn't gain back my full weight. I'd be like a balloon. I didn't gain back my full weight, but I did gain back about 30 pounds. And that's because, and when I stopped taking it, I started binging. And then, yeah, I know I went back on it, but I can't, you can't eat all of that stuff in there. But I feel better now. But, around this time of day, I'm having coffee. Y'all know I used to go to bed early. I don't go to bed early. I've been hanging out like 11 o'clock. My son, he'll call at 11:30 at night, so I have to hang out because they're in a different time zone. Okay, so again, make sure you get in on that program while it is $59.99. If you just want to do the billing program, just do the $9.99. If you just want the coding program, just do the $9.99. I'm going to send you just the coding program. Just first lesson, second lesson, third lesson. Whatever the lesson is of that program, that's what I'm sending you. And you're going to take that however you need to, okay? When you do the program, you get everything. You get everything from me. You get one-on-one, you get this, you get that, you Miss Lambert. Okay, let me get at you right now. My time is made for you. If you just do a course and I'm thinking, okay, so she probably knows a little bit about coding. All right, let me do that course. But if you don't, if you get stuck, hit me up. Let me know. Okay, let me know. Okay, so remember that tuition is going up on $9.15. So get in on that $59. I have to put it back to $13.89. $13.89, like now, like in the schools and stuff, that's when I gotta start interacting with the schools and stuff. But y'all know I always have a promo code for y'all, but it has to go back to $1,389. Okay, and I'll have to put the courses back to $79. Okay, so I don't care who, even if you don't want to do the program right now, just get it, put it inside, just register. Let me give you your email, and you got it. And then 2 months from that, Ms. Lambert, I got the program when it was $79. Okay, or when it was $59 or whatever. Okay, so now oncology. I know I'll be breaking up, but a lot of y'all ask me questions, and I'm trying to answer what I see right here. So the language of medicine, chapter 19, oncology. So again, I want you to open up when you're doing oncology section. I want you to open up your CPC book. Okay, your CPT book. We will work in the CPC guide. That's your last core course. That's one of your advanced courses at the end of your coding. We're working in that. But I'm not trying to overwhelm y'all with that now. It'd be like y'all got to get 25 books. You only have to get like 6 books or so, and that's better than getting a student loan for $27,000. Okay, y'all see that? No student loan. Okay, your syllabus. I have them here. We went over that the other day. I know I'm backtracking because I want to make sure I answer. Sometimes y'all give me questions. I want everybody to get the same answers. This is your syllabus, okay? And in your syllabus, it has how many hours your course is, what's in your course, what's in your class. This is a guide for you. This is a guide. That syllabus and that schedule keeps you on track. Make sure you have just like you're in school, make sure you have your notebook, make sure you have everything that you need. When you get stuck, you email Ms. Lambert. Email me at physicians@sapphirephysiciancoding.com. Okay. When you go to my website, I do take PayPal on there. So you guys can also do PayPal there, and you can do PayPal in the bookstore as well. Okay. So please, you guys get that course before it goes to $1,389. Okay. So again, we are on cancer medicine, oncology. But I still want you to read in your CPT book the last section, the medicine section, because there's a section on diabetes in there, and I think oncology in there. But again, we are going to use that book at the end of this section. Okay, so let's get back to the oncology. You guys are actually reading this yourselves as well. I'm putting you in the right place. For my new students out there, your Sapphire program comes with this book. Oh, I'm sorry, you can't see it. All right, let me get you in there. This is your language of medicine book. When you join Sapphire Physician Coding Academy, okay, you get this, but not this one, this 2025. but you do get a language of medicine book in there, which is fine. And I think you also get questions. You get questions and answers in there. I can't put it up here because this is YTU. I mean, this is a universal class, but you guys can see it in the portal. Okay, so everything you need is in the portal. If you have that Thrive and you say you want to learn medical billing, you want to learn medical coding, you want to get on the right track with the coding, you can do it. You can do it. You can do it. Take advantage of that $59.99. I have to put the course back to $1,389. Okay, but there's times when I get grants, that's when I give y'all those promo codes. I don't have no grant right now. Usually in, like I said, in November, I usually get a grant in November. I usually get grants in November. And you know, some of you who are opening your own business, I'll show you how to write those grants. Because it's just like you know, your business plan. You know, you want to tell people what you want to do. You want to tell the banks you want to do this. You want to tell the grant people you want to do that, and you just have to follow through. You have to follow through, and you will get grants. Okay, so let's get back. So you guys should have all of these words, all this terminology on index cards, and making sure that you are studying from there. So again, this is your theory, and you guys are doing practice when you go home. Well, you're home already, but you know, after this class, this is your theory and that's your practice. I did go over some of, you know, what we do in a lot of the chats, but you know, don't sleep on it. You know, go ahead and join the program. Go ahead and join the program. Okay. And I also show you what's in the program. Okay. Where's this at? So this is for you, Kamaya. I'm pretty sure you're going to archive this. I'm just pulling up the courses for you. And again, this is also in a chat, Kamaya. Oh, where's that? Remove that. Oh, here it is. Okay, so this is for Kamaya. And this is in another chat. Okay. This is what you will learn in this class. This is what you will learn in this class. Okay, so let's see. I don't have any index cards in front of me, but you can put that on an index card if you don't have it. Or some of you might have the downloadable YouTube. You can download that if it allows you. But again, I think you guys should take advantage of that program while it is tuition down. Okay, sarcomas. Sarcomas also are malignant tumors, but are less common than carcinomas. Now, you tell me two words like that sound so much similar. So you guys are going to get the sarcomas and then the carcinomas down. Omas we know are as in tumors, malignant and or benign, okay? They derive from connective tissue in the body and such as bone, fat, muscle, cartilage, and bone marrow, and from cells of the lymphatic system. So, you know, the bone, I didn't think the bone was, I've never met anybody actually with a bone until now. One of my besties, no, I ain't naming no names, has the bone cancer. And when you hear him, you wouldn't even think nothing is wrong with him. But, you know, he goes through the chemo and different things. And the way he says how he feels with the bone cancer, he says it feels like your legs are going to buckle. That's what he told me how he feels like his legs are going to buckle. And you know, this is a guy who was so active. I mean, he played football, he played tennis, he played everything, and he buffed. And you know, when he told me, I don't know if I was like, I'm sorry, you know, because his sister had it, his brother had it, and this is another one of those, oh my God, you're gonna get it. And he did. And the sad thing is that the chemo just makes him so sick. He's so sick. But he told me his bone cancer feels like his bones are very brittle, like he's gonna fall. So there's all types of cancer, and it depends on sometimes you run into somebody who has it. Like if you guys work at a hospital, you've seen this plenty of times, especially if you're CNA and you work on the floor. If you're a CNA, the best time working a CNA is from 3 to 11 is the second. 11 p.m. to 7 a.m. is the best time to work in CNA. When I first started in the medical field, I started as a CNA. So I saw so many different things. I saw the skin cancer. I saw all the cancer. It's just horrible. Okay, so often the term, I'm not even going to think of that, MESENCHYMAL tissue. So I want y'all to get that down, okay? MESEN, messen, CHYML, chimel. Y'all know I ain't pronouncing that right, but I want y'all to look that word up, okay? I'm giving y'all the definition, but I can't pronounce it. It's used to describe embryonic connective tissue from which sarcomas are derived. So this is not going to be in your test, but it's still something that I want you guys to get familiar with. No, you don't have to retain it like that. Just look it up, okay? Take your phone and type it in. I don't know where my phone is. I can't ever keep my phone in front of me. All right, so she's dead. Just look that up, okay? Osteosarcoma, bone, muscle, smooth muscle. My God. And when you're reading about the cancer, doesn't it make you want to go, wow? I don't know why that's there. Why is that there? It makes you want to go, wow. I mean, how can you treat it? Chemo. Blood forming tissues, fibrous tissues, fat, cartilage. It can attack any part of the body. Okay, so I want you guys to go ahead and read that. I'm on page 754. Nerve tissues, embryonic nerve tissues, mixed tissue tumors, type of tissues, kidney, malignant tumors, ovaries and testes, teratoma, germ cell tumor. Now, teratoma might be on your test. Teratoma, tumor composed of bone, muscle, skin, gland cells, and cartilage. Get that one again. Ovaries and testes. Teratoma, tumor composed of bone, muscle, skin, gland cells, cartilage, etc., and germ cell tumors. You guys know anybody with leukemia? I know. Yeah, I do. And trust me, I don't want to talk about that one because that touched home and family. But by the grace of God, she's good. Okay? By the grace of God, she's good now. In addition to the solid tumors of connective tissue origin, sarcomas include tumors arising from blood-forming tissue. Deriving from blood-forming tissue. Okay, this is leukemia I'm getting ready to talk about in case y'all know somebody. Leukemias are tumors derived from bone marrow. Lymphomas, such as Hodgkin's, Burkitt, follicular types, and multiple myelomas, are derived from immune cells of the lymphatic system. Glial cells, G-L-I-A-L, cells within the brain and other cells of the nervous system, give rise to malignancies such as gliomas and neuroblastomas. Okay? They don't give you a lot of, definition of the leukemia. I thought it would, but that's all it gives you. Then it says goes on with the mixed tissue. So you guys go ahead and read the rest of that with that mixed tissue down there, okay? I'm on actually 754, and Lord knows I can't show these pictures. Mixed tissue tumors are derived from tissue that is capable of differentiating into blood, epithelial, and connective tissue. Yeah, you guys go ahead and read that. Pathological descriptions. Cystic form, and yeah, we ain't looking at that. So some of these pictures, y'all know I can't put up. But I'm on 754, and I want you to go ahead and get that down. So inflammatory, having the features of inflammatory, that is redness, swelling, and heat. Okay, so you guys are going to get that down. Necrotic sounds like something that's going to be on your chest. Make sure you're studying that. Okay, containing dead tissue, necrotic, black dead tissue. Sometimes it's cracking. Ulcerating, characterized by an open, exposed surface resulting from the death of overlying tissue. Now, they're just giving you different type of definitions and different type of language of medicine here. Okay, it's because this is not directly relating to anything specific, but it can. So that's why they're putting it here. All right, so we don't need to look at that. So we did that yesterday. We talked about diffuse, dysplastic, epidermoid, resembling squamous epithelial cells. So you still want to get an idea of carcinomas, okay? And you're just making yourself familiar with it, because when you start reading the cases, you will be a lot more comfortable when you start reading the cases if you're familiar with the medical terminology and the terms. It's not easy to remember a lot of what we even read in the medical terminology. The goal for the medical terminology class is just to get you familiar with what's in the book, to get you familiar with the language of medicine, to get you familiar with the medical terminology talk of different parts of the body. Okay, so different parts of the body will be on your exam, because you're go to aapc.com, find exam, find CPC. It'll tell you what's on that exam, and there are 21 parts in the body, and they may ask you maybe 10. If these parts or those parts, these parts. If you fail, you may not get the same thing the next time. For sure, you're going to get different tests. Okay, I don't know what that is right there. Okay, so in the grading system stages, doctors fine tools are based on. Okay, so the grading systems would be something that the providers will be doing. We're grading a tumor, the pathological test concerned with the microscopic appearance of the tumor. Now, we won't have any pathological questions on the CPC. It's basically about systems, body systems, and their functions. Okay, this is consisting of tests. Okay. But you still can do it. I'm not going to read through that. I want you to still do it. We will go over cancer treatment. I want you guys to just do the cancer treatment. I'm on 757. Okay? And this is just approaches: surgery, radiation, chemotherapy, hormone therapy, molecular targeted therapy, immunotherapy. And it all helps. It also, you have people that have to go to chemotherapy and it takes it away. Will it come back? Maybe. Maybe not. Each modality as in the method, may be used alone, but often they are used together in combination. Surgeries. Okay, so this is what we would be more concerned with when the patient has a surgery and you guys have to read the note. In many patients with cancer, the tumor is discovered before it has spread. In many cases, yes, when you catch it early, and it may be cured by surgical incision. Some common cancers in which surgery may be corrective are those of the stomach, the breast, colon, lung. I'm thinking things that can be removed. If the patient has carcinoma that can be removed, sometimes it can be removed and the patient doesn't have it anymore. That's not to say that it may move around. Did you guys see on Twitter today? This is how we do it. What's his name, y'all? He has cancer. I hope I got the right song, but he's my guy. He said that his cancer came back and it started, metastasize to his lungs. It metastasized to his lung. It moved to his lung. So his cancer came back. What is his name? You guys find out his name, let me know. But, again, you always know somebody. We were talking about Eazy-E and how he got sick and things like that, and how he may have been the first one to, say something. He literally said something. He's passing on. And you do have other people who do say what they have. And but they are still here. That's their image, that's their image. Okay, cauterization. Cauterization is when you're burning off a tissue. Core needle biopsy, placement of a large bore needle that extracts the tissue. That's like it has a little hook on it. Sometimes it might have a little hole in it, a little like a needle. Cryosurgery, that's like cold, freezing cold. It destroys tissues. So would you guys get that now? I'm on 758. Okay, I'm just looking at what they have in here. Fine needle aspiration. Some of you guys had that. Pregnancy, you might have had something like that. Placement of a very thin needle inside the tumor mass, and not as a pregnancy. This is as far as a tumor mass and extraction of cells for microscopic evaluation. That's the same as they get this sometimes when you're pregnant, right? Has anybody had this before? I've never had it before, but I know some people do get that aspiration in the back of their back. Sometimes it tells you if the child has Down syndrome or anything like that. They want to run tests. Okay, they got to get it straight from that. Okay, fulguration, destruction of tissue, incisional biopsy, a piece of the tumor removed. Yes, I want you to get all that down. And you're basically building your index cards, which is going to be your study material. It must be storming outside. All of a sudden, it just got real dark. You are going to, you're building your index card. So when you guys hear me say, put this on the index card, make sure you get an index card. As you're reading your book, you will know what you need to put on your index card. Okay, but make sure that you guys read all the chats. Now, well, y'all can't read all the chats. Just read the basic ones. But the main three classes is the three I just gave you, okay? Radiation therapy. Now, there will be a radiation section. What happened? I lost it. There'll be a radiation section in your CPT book that we're going to go over. So, like I said, when we go over your CPT book, it's going to be kind of repetitious, but it's going to be other areas that we're going to discuss. Radiation therapy, RT. Employs high energy beams to destroy tumors. Brachytherapy. That sounds like test to me. Small sealed containers or seeds of radioactive material are inserted directly into the tumor. Okay, that's going to be in your CPT book, your CPC book when we start reading the CPC guide. Electro beams, low energy, external beam, radiation therapy applied to a tumor for distant source. Okay. Fractionation, methods of radiation into small. Everything in this section, get it down. Get all those words down. So we're doing cardiology. So we did 2 sections of cardiology. Everything that you get down on your index cards. If you don't have index cards, just use a piece of paper. Cut it up. Use paper like this and just cut it up. So you could just make yourself index cards. You know, you can make yourself index cards. And they don't have to be no bigger than this, you know, because you study it. This is what you're studying. So if we're doing oncology today, then that's what you're going to be studying. Okay. Phototherapy, linear accelerator, large electronic device. Yeah, just kind of get that down. You see this, like some of this, what we're looking at is going to be in your HCPCS book. If there's a device or something like that was used, it will be in your HCPCS, but it's medical durable equipment, it's shots, it's drugs, that's going to be in your HCPCS book. If you decide that you're going to be coding for the hospital, you're going to use that as well. And you're probably going to do PCS coding. I don't know what it's saying. I can't put this up here. Why not? This is before presentation, remove other media. Okay. I don't know if you guys can see me or not, but for some reason it's telling me to remove other media. What media? Okay, can you guys hear me now? All right. So I don't know what's wrong with that part right there, but I'll go ahead and share that part with you. Oh, it's something, it's a full screen layout. That's what that is. Okay, so don't worry about that. I'm going to move that over. Okay, good. Hi, how are you? Nice to see you. Okay, so we're going to take this down. I just wanted to make sure you guys could hear me because it was saying Okay, so let's get us back. So yes, again, hi, nice to see you. So we were talking about putting things on an index card and making sure that you guys have everything that you need. I was trying to put this up. That's what I was trying to put up so you guys can see this. So in radiology, I have a one of my girlfriends. She was a CNA and she took her test. This is my friend I was telling you about. She kept taking it. I was in North Carolina. She was in New York. And I guess she just finally called me. My sister told her where I was. Where's Lisa? This was like 10 or 12 years ago. And she told me that she keep failing. And I gave her exactly what I'm giving y'all. I told her how to study, what she's going to do with it. I know you guys don't get everything. But no, it is not too late to sign up for the course. You go to sapphirephysiciancoding.com and you can sign up for the course, sapphirephysiciancoding.com. When you go to sapphirephysiciancoding.com, you're going to click on a link. It says see more courses. And I want you guys to get on that before those courses go back to $1,389. It's just $59. In those courses, you get an email. You get access to the Sapphire portal. You get access to all of the schedules in case you change your mind and you want to change a schedule. You get access to your orientation. You get access to all the tests. You have access to all the coding material. The coding exams are there. In the Sapphire portal, you also get access to HR questions. Wait till you guys see my Sapphire portal. Y'all are going to pass out. It's only a certain amount of thing. I just kind of give you guys an introduction on YTU, but when you sign up for the program, you get all those different things. So when you go in there, you just pick the advanced course. I want you to pick the advanced course when you get in there. Even if you say, I don't want medical billing, I don't want terminology, get the advanced course because of that $59. I have to put it back to $1,300. Okay, but I'm not going to do it until the 15th. So you guys are good to go. Okay, if you get a single course, it's not considered joining the program, but you do get your courses. You just don't have access to the Sapphire portal where we give you, I'll show you how to do the essay. The coding courses are in there. All the syllabuses are in there. You get the language of medicine book with it. So yeah, I think this book comes with it. Not the 2025, but you get like a year before. You can download the book. So I have the rights to that book. So I have the right to give it to you. So you can get that book in that program. If you miss the medical billing course, you could always archive, and you and I do one-on-ones anyway. So everybody who registers for the class, we do one-on-one. Okay, so we make sure you don't miss anything. Okay, so that radiology course, it was just letting you know that okay, she did pass the test. She finally passed her test, and she's still doing radiology coding. I can't believe it. She's still doing radiology coding, and trust me, she's making a lot more than when she was a CNA because she done bought her a condo. Okay, so don't sleep on the coding, y'all. Don't sleep on the coding. All right, so right now I'm on 759, and don't forget that I just want to show y'all what figure I'm at because these words I want you to get. This book comes with my class. Okay, when you go on sapphirecoding.com and you click on Enter the Bookstore or see more classes, you'll see the programs at my bookstore. You can register right there. As soon as you register, remember, just download the introduction. The introduction is your orientation. So it takes 1 week for that orientation. So some of you who started last week, this week, you should be starting your courses. Okay? You don't have to download if you don't want to. When you go to the Sapphire portal, you can just open the course that you want. When you download from the bookstore, you can download one at a time, or you can download all of them. So once you finish with that week, I give you a code to download the rest of those courses, okay? So again, this book right here, that's the medical terminology book. It comes with the course. You cannot decipher the reports without medical terminology. So you guys see how I'm doing the medical terminology. I'm literally just kind of scanning through it and scanning through it. And you are really doing the in-depth reading. As you guys can see, I go through every book page by page. We have gone through the medical terminology book page by page. We are up to page 759. In my file, when we first started this course, that's your medical terminology course. How many classes is in this course, Ms. Lambert? 21 classes in the medical terminology course. 3 days a week. Monday, Friday, Saturday is classes, okay? 2 hours a day, okay? 1 hour theory with me, and you have 1 hour theory at home, 1 hour practice at home. You can do an extra hour for 42 hours theory class, okay? Theory class as in we're doing the theory, you do theory at home. Theory is me talking, me addressing what we are doing, me showing you what you need to do. The practice is you doing the exercises, you're doing, you're doing any type of test or task that I have given you. So, do not forget, in this classroom, we have so many different things that we teach you. That's the reason why I want you to stay coordinated. So that's why these 3 classes are in 3 different playlists. As you guys know, I have almost 500 videos. But how you're going to keep track of what you're doing, that syllabus, the schedule, you'll notice over here somewhere. The syllabus, the schedule will keep you on track, okay? Do not sleep on that. If you are just YTU, no problem, and you want the test to this course, then you must get the book. You have to get the book because I can't put my test on YTU. I can't put my test on YouTube. So my book is here. I'm gonna share my screen with y'all. The Sapphire series is there. Make sure you guys go ahead and get that Sapphire series because this is what I did to make sure you guys get your test. This is the Sapphire Physician Coding Series 2. In the Series 2, there are the medical terminology, just like how we're doing it now. But the difference is because YTU, I cannot give you classes, my tests on the YTU. The tests, I have put them in this book. So you have 50 questions on each test. Same thing Sapphire has. Same thing Sapphire has. I have to put it in here because I have to put a copyright on my test. It cannot be copied. So I have to put them in my book. I cannot put them on YouTube. So you have 22 tests, 50 questions each, and I also put the answers in there for you. Okay, so that is for YTU who is not part of the Sapphire class, but I still encourage you as well. Those of you who are YTU, YouTube University, and are not already registered into my class, okay? The red book is the medical terminology Q&A. The medical terminology Q&A is what's coded, Miss Lambert? What's billing, Miss Lambert? Miss Lambert, what's 99212? Miss Lambert, what's ambulatory coding? Miss Lambert, how do we code? What is coding about? What are we looking for? That's in that Q&A book. Okay, there's medical terminology in that book. There's poems in that book. There's poems there because some of my students, when I was in the physical class, they wrote a lot of poems about me. So I put the poems in that book, and that's an amazing book. Just make sure you guys get it. I don't know if I have the other book on there. I don't have enough of room to put it on there. I do. So this one here, can you guys see it? That's your medical terminology series 1. This is you don't know anything about medical billing. That's the medical billing book. Okay, that's your medical billing book. So I did create something for people who may not want to join the class. Maybe they're not ready. Maybe they want to know a little bit more. So that's the reason that was created. Okay, so again, when you guys are doing your self-study, you just have to pace yourself. You have to pace yourself, and you have to put yourself in a position where nobody is around you. If you say, okay, I'm going to read these 2 chapters today, just read the 2 chapters today. Don't overwhelm yourself, okay? So again, we are now, let's get back to radiotherapy. We're on 761. And basically, it's just giving you an idea of what cancer patients may go through. I'm gonna take this down. I'm gonna show you what I'm looking at. Because there are times when you might know somebody and you just want to go, well, how does that work? This is for some of you who are not working in a hospital. Maybe you guys haven't worked in a hospital before and you just want to see what it's about. This is an ebook, and an ebook actually has things that actually move around. It's not going to do that in a regular book, but sometimes you see how it looks like that, like it's like a 3D. In your regular hard copy, it might look a little different, but it's the same thing. But in medical terminology, which is what we're doing now, you see how the things that we talk about is real world stuff that actually happens. Okay, so let's get to 761. And again, you guys should have your books. If you register for the program, this book is free. If you don't, I would try thrift.com in case some of you want a hard copy book. Okay, so this is figure 19 to 10. Okay, proton therapy machines. And that's what we just looked at. They're just showing you at what point do they take radiation cells. Okay. So radiotherapy, although it may be either palliative, relieving symptoms, or curative, curing the symptoms, can produce undesirable side effects. We already know that. We talked about that a few minutes ago. And, it's just like dialysis. After, the dialysis is horrible. You couldn't tell me it was that bad. My mother used to come from there. I couldn't even tell that, it was really, really bothering her that much. Until the end, I think it's just as bad as radiotherapy. So radiotherapy side effects. Okay, so I'm on 761. I want you guys to still get this down. Acute inflammation, nausea, vomiting, yes, alopecia. It causes all these things. Cystitis. They're just giving you a list of the side effects. They're giving you a list of the side effects. And, I'm not saying you might have multiple choice question of it, but if you do have a question and CPC says, well, what are some of the side effects of, radiotherapy? And then they'll have it in multiple choice. And then in the multiple choice, they'll have like 3 different words. Again, you're not going to remember all this, but you're going to have, an inkling of what she's talking about. Okay. Well, I'm saying she, but this is CPC just. Okay. Chemotherapy, what we most hear people talk about, cancer chemotherapy is the treatment of cancer using chemicals, drugs. It is the standard treatment for many types of cancer and is curative in a number of them, such as testicular cancer. So they're saying that chemotherapy has cured testicular cancer, acute. I remember back when I used to work in an OR, I wish I could remember his name, and he was so funny. And I know so many people with this cancer. I'm telling you, I can't stand it. We used to do. Matter of fact, he was with me in cardiothoracic. He was with me in cardiothoracic and with Dr. Graver. And he got missing. We just didn't see him. That was me in his room. And he just got missing, and he came back, and he was like, man, they running tests, they this and that and that and this. And he said that his problem was it would stay firm. It would stay firm, and he wouldn't know why it was like that. He had no idea, but it would stay firm. Sometimes people take the blue pill and they stay firm for days, and that's what they get for taking it. In this case, he just said that I think he said he was going to the bathroom a lot, and his testes either was firm or he was just firm. And I was like, oh my God, you got to come back to work with the bad news. He was like, man, I ain't believe it. Because he was just at work. But I guess when you have to get that prostate screening, and it wasn't even 60 days. And he was gone. And I couldn't believe it. What you do is you just feel like, how can this happen to him? I mean, when I was in the OR, I was just big when I used to work in the OR many years ago, and I mean, we were such a team. And you know what's crazy? Some of us still work in the OR. When I go on my Instagram, I shout out to North Shore quick. Long Island Jewish, not North Shore, but Long Island Jewish. North Shore was down the street, Community Drive. We Long Island Jewish. We used to have so much fun in the OR, and just as long as I didn't have to go in on a craniotomy, I was okay. I was all right with cardiothoracic. I was all right with surgery, but something with that, I just could not go in there. And the children, I couldn't do it. I couldn't go in there. If I had to come in there with an instrument, somebody got to do it for me. My sister actually worked in the OR with me. I'd have to call her to come in there and take it in there or something. But anyway, y'all know how I get throwed off when I start talking about medical. But bless his soul, he passed away. It was just so fast. So again, I'm gonna go over this again, and this is just giving you an idea of what people go through, and it's giving you medical terminology. Cancer chemotherapy is the treatment of cancer using chemicals. Drugs, we just said it. I'm just backtracking. It is the standard treatment for many types of cancer, and is curative in a number of them. Curative as in it cures cancers such as testicular cancer, acute lymphatic leukemia in children. Yeah, I remember I told you, by the grace of God, she's good now. I mean, they had to fly her from one state to the next. I mean, and that was the scariest thing in the world. And that was the first time I ever seen my mother cry. My mother was the strongest person in the world. That was the first time I ever seen her cry. My mother always steadfast. You never seen my mother blink. When you hear somebody talk about the strongest person in the world, and that's probably why I'm more or less like that, and some of us are like that. You just straight strong. My mother was like the strongest person in the world. You couldn't break her. If she broke behind doors. You did not. I don't care what went down. My mother was a king. But that day when they told us that, because we was in New York and they were there, and it was just, oh my God. But again, chemotherapy, curative, can cure leukemia in children, and Hodgkin's and lymphoma and large cell lymphomas. Well, we know that. I've seen that on shows. Don't sleep on YouTube. Make sure you go when you guys got a question and you can't get Miss Lambert. Search engine is my go-to. Search engine was my go-to. When I was in the college and I used to teach the kids, but it wasn't kids, it was college. It was adults. That was our go-to, and that was in 2013. That was in 2013. 2014, I think we created Sapphire Physician Coding. So that's how we started doing the online mix with the school. I don't know. I think Phoenix does that. Phoenix may do a mix because I did half online, and then I did the other half with my students in the classroom. They took to it very well. But if they needed to search for something and they didn't know what it was, that's what they're going to do search engine. Okay? And when you guys get ready to write your summary, don't sleep on Grammarly. If you can't figure out how to figure out a word, or your grammar's horrible like mine, I don't send no emails out without doing Grammarly. So, I had a CEO, and that was her pet peeve. You better not send me nothing with an error on it. She didn't say that, but she wanted to. And it was like a rumor all around the campus. Don't send out nothing such and such a Grammarly, whatever you send, and then you send it. Okay, so that's a word from the wash. I always mention that. You send to somebody an email that that's indignitary. Don't send them how you talk, because y'all know I talk. I type just how I talk, but I cleaned it up. Okay, so drugs causing tumor cells die, damaging their DNA. Yeah, you're going to get that down. I want to find the clinical trials, because the Russia thing. You remember we was talking about. We wish that somebody was coming up with something for the cancer, and then all of a sudden, and I was kind of asking it came up with the Russia thing. I was like, oh my God, we were just talking about that. And I'm like, I don't know anything about, the clinical trials here or people actually getting clinical trials, but they did show the Russia thing. The ideal is to administer drugs that kill large numbers of tumor cells without harming normal cells. I just can't imagine it being done without harming other cells. I'm saying, and I'm saying this to say, when you guys do studying, you put yourself in the OR. As you guys are learning the coding, put yourself in the OR. Okay, you have to visualize what's going on in there. Okay, the ideal is to administer drugs that kill large numbers of tumor cells without harming normal cells. However, rapidly dividing normal cells, such as in the bone marrow. And that's what they want to give my friend. He's I don't know, he keeps saying he's scared to get it, but I've seen people get bone marrow, transplant, stuff like that. He said he don't want to get it. He's scared of it. I need to call him tonight, see what's going on. Okay, and another friend of mine, he passed. I gotta ask Samantha and what happened to him. Okay, so y'all see how I used to get thrown up. Okay, so research physicians measure drug levels and their rates of disappearance from the chemotherapeutic drugs. Research physicians measure drug levels and their rates of disappearance from the bloodstream and tissues. I kind of backtrack on that. They use information from animal experimental and clinical trials to design better routes and schedules of administration to achieve the greatest tumor kill with the least toxicity harm to normal cells. Now, so I guess they have done, as they do, CDC does this too. You use animals to test things to see if they work. So maybe Russia has did enough of testing on their samples, and they have decided that what they have come up with is a drug that can now be tested. And I think that's amazing. Absolutely. I mean, it doesn't matter who came up with the solution, even if it's just testing the cancer drug for temporary, testing the cancer drug for, I don't care. They are the ones that are going to have a miracle happen. Everybody cross your fingers. Russia they made their move. Combination chemotherapy is the use of 2 or more drugs, which we talked about a little while ago. Okay, remission. Make sure you get that word down. Remission. Okay, drugs are given according to written protocol or plan, provider's plan that you won't see in your coding, but you will see it in the intake. The provider may have a plan in there. That's not something that you code. That's documented. Or plan that details the route, schedule, and or frequency of doses. Usually drug therapy is continued until the patient achieves a complete remission. Man, I guess, I don't know. I know so many people who have had cancer and different types of cancer. It's just, I don't know sometimes if it's just disbelief. I know somebody who just, I don't know if she believed she had it, or maybe she was in disbelief and she didn't want to get the hysterectomy, and it started spreading. I don't know if it was too late. All I know, it was 1 month, such and such has cancer. No, the next month she was inability to function. I'm like, well, so everybody is different. Everybody is different. But again, those of you who are in the medical terminology class, I want y'all to read this, because it's informative. And those of you who missed the beginning of the oncology class, make sure you get back to it. I gotta see how far we are. We can do. Oh my God, I'm 10 minutes over. This is going to be a third class, y'all. There's going to be a third class. I have to stop. I'm already an hour in. So those of you who did join the Sapphire Physician Coding class, look at the orientation. Everything is in PDF, and then you have some digital files. You and I will get a one-on-one. I'm already 10 minutes over. There will be a 3 to this portion. Okay, there will be a 3. Okay. Okay. Thank you all. I'll see you guys again. Your next class is going to be Friday. We are still in oncology. I know. I have to go through this word for word. We are still in oncology. I will see you guys again. I'm probably going to get an email from some of you, but I have to do a third oncology class because I know this class is like totally interesting and you guys are into it word for word. So when you guys archive this, know that there will be a 3 for the oncology. Because it is so interesting. I know. That's what we were talking about. We know so many people that has had cancer, and this portion is telling us so much about clinical trials, different types of cancer, how people feel with chemotherapy, what the chemotherapy is, and it gives you an idea of, oh my God, my friend went through this. That's the first thing I think about. Look at the first oncology section. Y'all can hear my story. And the first thing we said was one of them was gonna get it. They were my besties. We were like this, and we were on the phone. We're waiting for that phone call for them to come in and say that their dad passed away. And we're like, no. That call came in at about 11:30, 12 o'clock that night. And they dropped the phone. And I'm standing there like, oh my God. And they were like, one of us is going to get it. We were like 10 and 11 years old. I told you, we were like 10 and 11 years old. And I'll never forget it. I swear, I remember like it was yesterday. And what happened? They got it. My bestie, she was about 30 something. Thank God she had kids already. She get it. She passed away. And the other bad news, 10 years later, her sister got it. I'm looking for her. And, that's what happened. So I want you guys to know all about, the cancer, know all about oncology. Okay, so we're not finished with this. Friday, we're back in oncology. I see you guys. I'm gonna hang up because y'all know how I go get carried away. Okay, we're already 1 2 minutes in. Enjoy. I'll see you guys next time.